Over the weekend, we learned the Omicron variant is now here in Ohio.
And tonight we know it was discovered by the Cleveland Clinic in a patient's lab sample. The news comes as we're still in a COVID case surge, with the state reporting more than 5,600 new cases today. Arlene Elias spoke with experts about what's next now that the new strain is here.
As the U.S. passed 800,000 deaths from COVID-19, the newest variant, Omicron, has now been found in 32 states. On Saturday, the state's first cases in central Ohio, and Monday, the first case in Cleveland, confirmed by lab testing at the Cleveland Clinic.
What we're trying to figure out, and what isn't completely clear yet, is the severity of infection. So is it going to cause as severe disease as, say, Delta?
The Ohio Department of Health says the state's first cases of Omicron were in two men, both vaccinated more than 6 months ago, but did not get the booster. Neither traveled internationally, and both had mild symptoms.
We're trying to do, real-time science here.
Dr. Daniel Rhodes from the Cleveland Clinic says while initial data on Omicron in South Africa found mild illness,
I think it would be prudent to wait to draw conclusions.
But Omicron does appear to spread more quickly than Delta, doubling in cases every 2 to 3 days in the UK, which Monday announced the nation's first Omicron death.
Even if it does turn out to be less severe in most people, if it causes severe disease in some people, if it's more transmissible, that's going to still cause a lot of problems.
Scientists in Israel found a second dose of Pfizer's COVID vaccine had little protection against Omicron after 5 to 6 months, but a third dose offered significant protection against the new variant.
Vaccines are still effective. They're just not as effective as they were with Delta.
And doctors say it continues to be the best protection available.
And doctors urge getting vaccinated and get your booster if you're eligible. And now some companies that mandated vaccines are now considering requiring booster shots. Tonight, the NFL is saying that it is now requiring coaches, team staff, and personnel to get the booster shot by December 27th. Betsy, players not just yet, they have to negotiate with the players' union.
All right. Thank you, Lena.